Hi, my name is Nicholas Yam. I'm a student nurse and I'll be demonstrating how to prepare a heparin infusion. So I have my physician's orders as well as my my physician's orders for VTE, a heparin dose adjustment, as well as the MAR itself. So as well as the PDM. So I have so I'm going to first do my first check. So I have with my physician's orders as well as the MAR. So Wendy Holmes, Finn 1 2 3 4 5 6 7 8 9. Wendy Holmes, Finn 1 2 3 4 5 6 7 8 9. Okay, and I'm going to check the what I'm giving. So it's heparin. The dose is 25,000. 25,000. We're going in D5 250 milliliters. The concentration is 100 units per milliliter. It's going to be given today, and it's going to be given via an IV. So I've done my first check, as well as I'm just going to double check with the medication. So it is heparin. It's an IV bag. It's given in 250 milliliters. Its dose is 25,000 units. It's okay, so that's okay. It's not expired. It's in D5W, so that's good. I'm now going to check the chart for heparin. So heparin, so we got heparin here. So it's a high-level medication. You can give it via a student nurse. That's myself. It is the IV, which is the continuous. So it's so we're looking at how much was the heparin units per hour. So it's 1350. So if we look at the maximum initial dose, it's under 2,150, which is good, so that's okay. So we're just going to make sure we take a look at the stability, so it can be given in D5W, and the baseline ABT and CBC have been taken, so we're good to go for that. So we're just going to put into the Collie Guardian here, and using the VTE here. So that's good, and it is also, we're just going to talk about the potential hazards to the patient, like bleeding and thrombocytopenia. So now we're just going to prepare it.
So I just want to double check to make sure
So,
you have everything and just follow
so I have
this is the cumulative blood record. I will go back to that in the end.
label here. So I have
So we're going to bring this into
Wendy Holmes. It's heparin, 25,000 units. The volume is going to be 250 milliliters, and the diluent is as D5W, and it's 250 because it's in. The concentration is going to be 100 units. It's going to be March the 11th, 2019. It's 2019, and the time is 10:35. Okay, and the signature, I'm going to put my signature. Okay, and then I would just, so I would do my second check now. So then I have my, just make sure that I have the proper dosing, the rate, which is 1350 units per hour. Okay, and I'm just going to make sure that it's on my bag here. Okay, and then now I'm going to just do my second check. So I have my so I'm just going to check my so I have here my adult for Wendy Holmes. Wendy Holmes spin is 1 2 3 4 5 6 7 8 9. I'm looking at the it's given today. It's heparin, so it's heparin, 25,000 units in D5W. in 250 milliliters. So D5W 250 milliliters, D5W 250 milliliters. Yeah, and it's 100 units per milliliter. It's going to given today, and it's given via IV. So I also have my IV tubing. This one's a straight, so it doesn't have any ports in it. So because it is a higher medication, and then I would just get my second nurse to check this, and then she did. She's checking for the Wendy Holmes. The fin 1, 2, 3, 4, 5, 6, 7, 8, 9 is given today. The root is IV, and it's 25,000 units and 250 milliliters of D5W with a concentrate of 100 units. It's given today, and she will sign it here, right. Second nurse check would sign that there, okay, and then I would just get this, and then I would just start priming it. So I would just do my hand hygiene, which is over there. I'm just gonna quickly grab it from here. So we do hand hygiene here before I start. Okay. So, alrighty, and then I will just put this all away. So this will be good. I have this flush to check as well as things. So then I'm just going to go into the room and do my my NPC check. So I'll do my hand hygiene. Knock. Hi Wendy. My name is Nick, and I noticed that she has a tray. So I'm just going to raise the bed.
Yeah, so it's right here. So it's Scotland Price and the number is 12345645678 Scotland Price.
Okay, and I have my Samara cell as well as I have my medication here. So I'm just going to bring this closer, and I'm just going to now take a peek and see. Okay, so her, what's it called? Her check. Her wristband is over here. So I'm going to take this, and I'm going to look at her wristband. So it's Wendy Holmes. Fin is 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. Can you tell me your age? She's 35, which matches up. That's good. And then so I'm going to ask her, Wendy, you're getting this medication called Heparin, and it's an anticoagulant. What that means is that it's going to prevent your blood from clotting, because we don't want that in your going through your blood vessels, because that can be quite dangerous if the clots enter your heart. So what we're going to do is give you this infusion called heparin, and it's going to keep going continuously so that you don't have any clots. There are some side effects, such as bleeding. So if you notice any bleeding from, say, the IV site, or you feel dizzy, just let us know. Okay, you have the call. Okay, so then I'll just come around to the other side. All right, so I've done my. So now I'm just going to do my third safety check. So I have heparin. I have Wendy Holmes. So Fin 1, 2, 3, 4, 6, 7, 8, 9. She's 35 years old. We're going to look at it's given today, which is March 11, 2019. That's good. What's it called? The rate is going to be 1350 units per hour. It's in 25,000 units, which is the dose in D5W 250 milliliters. It's 100 units per milliliter. It's going to be a route of IV continuous via the Collie Guardian. And
So I'm going to select that. My Collie Guardian is really
all right,
smart,
and then
so it has 100
that's
units
about.
already. I'm just going to make sure
Yeah, and I've signed it, and the second nurse has signed it, knowing that she's seen it, and I'll just get her to check again with the pump itself. So I'm just going to spike it. So normally there would be a spike on this one. So in the presence of the demo, I would take it off, remove it, maintaining my sterility, and then I would take this off. Okay, and of course no medication would come out. So okay, so before I would do this, unfortunately, I would do hand hygiene, right? And I would take this. So this is the spike that would make it sterile. So then I would take this out, right? And then I would take this, right? And I would spike it, maintaining my sterility. So, like so, not touching that spike itself. And then I would just take it to the garbage can over here and just begin to prime it, making sure the end doesn't touch the bottom of the floor.
So we're gonna open this up.
So you can see here. Okay, so now it's primed, and since this would be new tubing, there wouldn't be any air bubbles.
So I've primed the tubing and make sure that there's no air bubbles or there's no air leaks there, there's no air bubbles so that the air won't go to my patient. I'm gonna attach this.
There's 5 minutes left.
I'm gonna attach it to my patient.
So like I said, we're going to be changing.
Okay, so there's no air bubbles now. I've locked it. I'm just gonna head over to the
So we're gonna attach that.
and hang it up.
Have Amy go on the
So I've done my third check. I'll just do.
For volume of 340.
So. Okay, so I'm gonna take this, which is my. So I'm gonna open this up now. So I'm gonna press.
It's all good. Okay, so we would change that again after 15 minutes. We're going to remain with the patient so that he's good and we're monitoring him. And then, like I said, the vitals that we would repeat. So we're finished here. We're going to return the patient back down to the lower position, make sure he's comfortable. Clean everything up. I'm going to ask my second nurse to document in the 2-minute blood record that we've
We're just having a little technical difficulties here. Getting the tubing in. That's it. There we go. Okay, so we're gonna program it now. So we're gonna go to Collie Guardian. So we're gonna change it to. So we're going to go look at our heparin. So it's VTE. So we're choosing the VTE one. So we'll go select. Okay, and we're choosing the dose, which is 1350 units per hour. So it's 13.5. That's why we have the carrier, because it's less than the TKO. So that's why we're going to attach it to the Y site here. So we're going to say confirm. And then we're going to have our second nurse check that, and she says it's okay. So then we're now going to just get this ready. So we have the Y site. So we're just going to take this. All right, and we're just going to take this. Swab it again just to maintain sterility. So, so we'll just put this in here. You know, there's no bloods here. So I would push it in and say, you know, do you feel any pain? They don't, so that means there's no problem there. So we're just going to now maintaining sterility. Attach it here, and then I would just make sure it's not clamped, you know, and then I would just say press start, because I've already consented and everything, so that's good. Press start, and I'll just make sure the drips are coming now, so 3 drips have come in. So then I'll just say to this patient, you know, if you have any bleeding or any thrombocytopenia, please give us a call with the call bell, so let us know if there's any problems, okay? And I will just do my exit safety check, as well as do my documentation of the patient, the time, as well as how it is received, as well as I'll look at, as well as doing the ABTT blood work 6 hours after the initial infusion, okay? And that's sort of the demo of the for heparin infusion.